Hello everyone, my name is AJ Clevenger. This is my partner Alfredo.
Indeed.
We'll be teaching you how to do a chest x-ray, PA projection, and also a lateral projection. Alright, so what we're going to do is we're going to go to the control panel first to set up our exam. So what we want to do is we want to hit chest PA on here, hit select, and we want to make sure that this is on a wall bucky and that it's a chest stand according to this. And from there we can go to fixed, which we can do a manual technique. And what a normal range would be like 120 kVp for the wall bucky. And just when the patient comes in, we will adjust the mass according to the density of the body of the patient. So also what you want to do while you're setting up the room before the patient comes in, you want to make sure that you're detented with the tube to the bucky, and you want to be at 72 at a distance, 72 inches, and you want to make sure that your crosshair on your tube is lined up with your bucky here. Also, you want to make sure that you have a film in here as well with the marker of the film on the right side of the patient, or if you're doing it portrait-wise on a PA, which you could on skinnier people, it'll be on the top portion. So we're going to make sure that's in there. And once you put it in on automatic tubes, you'll see that it'll detent to the square of the whatever film you put on there, whether it be landscape or portrait. Also, you want to make sure that you put your left marker on here, just in the general area, so you don't forget when you bring in the patient. Alright, so what we're going to do, we're going to bring the patient in, and what we're going to do is we're going to double ID them. We have the rec here, so we're going to ask them with their full name, their birth date, and if it's a female, we're going to ask them if they're pregnant or not. Sir, what's your full name?
Alfredo Medina Pantoja.
And what's your birthday?
June 7th, 1985.
Okay, great. And what you also want to ask them what kind of type of history they have, and a reason why they're here, maybe. Sir, why are you here?
It's just a pre-op exam. I'm having surgery next week.
Oh, okay. So just like that, just want to ask some information and jot down in the DICOM later. So we're going to get this patient set up. So what we're going to do is we want to put a patient gown on them and let them know that if there's any necklaces or rings obstructing the chest area, and make sure that they remove them. Then they put the gown on with the back open, just like that. Go ahead and give a little turn around there. So see, it's open in the back, and if they need help, you can help them just tie the top and bottom. Okay, so now we're going to bring the patient to the bucky area. So we're going to be doing a PA chest. So you want to make sure that you bring the patient up to the bucky here. And what we're going to do is we're going to shield the gonad area, since this is a male. And even for females. You want to make sure you don't shoot the ovaries. Adjust the shield according to height. Alright, sir. So what we're going to do is we're going to put you up against this board here. We got the left marker on the left side of the patient to represent the anatomy. Alright, so we got here, what you want to do is make sure that collimation light and the CR is exactly at T7. Another way you can find out is look at the bottom of the scapulas, kind of feel around right here. So I want to feel around. Scapulas are and then you want to make sure that it's right there at T7, which it is right now. Alright, so it looks like we're ready for the x-ray. Make sure that the arms are up or around, shoulders forward, get the scapulas out of the way. So what we're going to do, we're going to go to the console right now, and we're going to set the technique. And I'll go like at 120 at 8. It's a little bit bigger density, so we got to shoot through a lot more. Adjust it accordingly, and what we do is we're going to tell the patient to take in a deep breath, let it all out, take in another deep breath, and hold it. Zap. You make sure that as the patient is breathing and holding it in, you want to click while looking. That way the patient, there's no motion or anything going on. And go ahead and breathe, sir. You feel it the whole time?
Yeah, I'm sorry.
We're going to set up here for a lateral chest view. What we're going to do is we're going to put this according to portrait. This marker side on top of the cassette. Alright. And we're going to tell the patient to go ahead and lift up their arms. So we get a feel here. If they're unable to lift up their arms, you can always tell them to hold on to this pole here if your department has one. And what we're going to do is we're going to have the patient scoot on over to his or her left. Make sure that the marker, I like to put the marker behind the arm here so it doesn't get burned out. And still on the left side. And we are going to adjust the patient so that the crosshair is right in the middle, vertically. And what I like to do is drop the bucky maybe about an inch lower than our PA. And then you want to make sure that your vertical is matching up with your bucky as you lowered the bucky an inch. You want to make sure that crosshair is still at T7. You want to make sure that you have a little bit of collimation light behind the patient. And you want to make sure that the patient is not rotated. Just like that, sir. Alright, so he's in lateral view. So now that we have the patient set up, I'm going to go back to my console. And I'm going to readjust the technique. I'm still going to go at 120, but the mass has to be doubled since you're shooting it laterally. You got a lot more anatomy and density you have to shoot through, so you have to double your mass. So I'll probably shoot them at 120 kbp at 16 mass. Sir, go ahead and take in a deep breath. Let it all out. Go ahead and take in another deep breath. Hold it. Click. And breathe. Always make sure that you tell them to breathe afterwards. Alright. And that's it. Go ahead and relax, sir. You did a good job. Looks like that you tested negative. And
well, I want to thank you for the excellent service.
Now I have AIDS. Now after each exam that is completed, we will bring the cassette over to the reader. We will find the barcode in back of each cassette. We will scan the cassette. Then, once the beep, we will put the cassette inside the reader. Then what the reader will do is bring up the image up on the monitor. Then from there, we critique. Alright, so now that we have the image up on the monitor here, we want to go ahead and critique it. We want to make sure that we have a few items on here. What we're looking for is that we're looking for the apices. We're making sure that they're there and that the clavicles are out of the way. That way you can see the top of the apices. You want to make sure that your SC joints are in there to look for any rotation. Make sure that they're equidistant from each other. And we also have the air trachea field here. And let me see, what else do we have? Oh yeah, we also have the scapulars out of the way, which are usually superimposed of the third rib. Also, we are looking for actually we're looking for any cutoff for the concentrating angles, which we don't in this picture here, which is good. We're going to make sure that we've got the diaphragm. We got the left marker marked on the left side anatomically. And also we got to look for 8 to 10 ribs. Alright, so now we're going to critique the lateral view. So once we have it popped up here, we're going to see and make sure that we didn't cut off any cross-fitting angles here, cross-fitting angles. We also want to make sure that the diaphragm is here. We also want to see that there's the heart shadow. As we can see right on top of that is the hilar region. also want to make sure that we want to see the posterior ribs superimposed of each other. We can also see that the intervertebral discs or spaces are open. The other thing too is to make sure that we didn't cut off the apice as well of slung here. And then also to check to see if there's any rotation at all. We want to see the sternum, like in the lateral view. Otherwise, that looks like a good lateral view there. Also, we got the left marker.